Rowena is a project planner and licensed clinical social worker at National Child Traumatic Stress Network at Duke University and has worked alongside families impacted by trauma in Illinois, Michigan, North Carolina, and Spain. Her passion is to address trauma through re-envisioning systems to meet the needs of children and families impacted by trauma so that communities can heal and thrive. So join me in welcoming Rowena and for her to give us a message from NCTSN.
All right, welcome all. Thank you so much for helping me with the check-in. I have gotten so used to doing Zoom that being in person in 3D feels really a treat. So let's get, we'll see. All right. So you'll see my reality of living on Zoom come up in that just a second. I need 2 monitors, so there you go. Cool. Thank you very, very much. Oh, that's fair. So I can keep track of time. Okay. Okay. So welcome all to the Advancing Connections and Community-Based Practices for Trauma-Informed Care for Asian American and Pacific Islanders. I know that quite a few of you had to drive and get here and park, and thank you so much for acknowledging that. I was freaking out a little bit this morning. It took me 30 minutes to get 7 minutes, so I was like, oh, okay, we're gonna get there. But welcome, so glad you're here. And Dr. Turu and the rest of the team, thank you for having me here. And also, just to kind of introduce myself, my name is Rowena, Mudiappa, and I am with the National Center for Child Traumatic Stress from Duke University. And I'm going to tell you a little bit about myself that's not in my bio. And, this screen. Okay, y'all will work with me. So I was born and raised in Sri Lanka, and that's the flag, and that's my family. I think I'm 11 years old in this particular picture. So when I was a teen, my mom, my siblings, and I moved to the U.S. We immigrated to Chicago, where I finished high school, undergrad, and graduate school. And then a few things, a little bit more about me. I grew up in a 2-parent home. And when part of my family immigrated to the U.S., my parents had just gone through a divorce. And my mom became a single mom of 4 kids, which was my 3 siblings and I. And raising us in a whole new country. It was quite a shock of a wave of a shock. So anyway, so that was quite a traversing time. And then when we moved to Chicago, we were embraced, my family and I, we were embraced by the faith community that we were part of. And they played such a crucial role in my own kind of adjustment and adapting and my social emotional development. And I found some lifelong friends that have now become family. And some of them are in this picture. This is me in undergrad with some of my friends. Somehow I didn't get the memo that for spring break, you go to warm places. This is in Maine. For spring break, my friends and I. And that's a recent family event, and that's my family now. And these are some of the kids in the family. So 2 decades later, I now serve as a liaison, a project planner for the National Child Traumatic Stress Network. And I'm also the founder of an organization that provides trauma treatment to those who have been impacted by trauma. I also train organizations on what it means to be trauma-informed and secondary traumatic stress. And I also provide reflective supervision. That's some of the things that I do. And I'm really proud of that work. But one of the things that I'm very proud of is to be an aunt to 11 kids. And these 2 little ones are 3 weeks old. I'm really proud of them, but also just really the things that motivate me to do the work that I do. So I am gonna, Hold tight here. And then where are you? I want to know who's in the room. And so, actually, let me go back here. You see this QR code? So take your phones out, scan the QR code. If for whatever reason the QR code doesn't work, it's a Mentimeter, and if that's new to you, you can scan the QR code, and if it's not working, let me know and I'm happy to give you the code for it. So there are 2 questions. Is that working for you all? Is it doing what I'm thinking I'm wanting it to do? Yeah, I see. Ben, you're nodding. It's working? Let me see. A couple more nods. Is that working? Okay. All right. Okay. Okay, so the 2 questions you'll see. The first one is, what's your role in your organization? And what are parts of your identity that impact how you show up in the work that you're doing? What are the things that are salient to you in how you do this work? Is there Wi-Fi here? Chris?
There's no password if you connect the guest Wi-Fi. Yes. Yeah.
All right, so I'm gonna switch screens. I'm hoping that Menti is working for you all. I see quite a few responses. And so if for whatever reason that's not working, try mentimeter.com. And then there's a code that you'll need to put. It's 7235-3872, in case that's helpful. Okay, all right, so that's where we're going. All right, let's see who's in the room. Yay! Lots of different roles. We've got, okay, I love when Mentimeter does this. So we've got a cheerleader in the house. We've got a mental health clinician, a mentor, an academic, a creative art therapist, someone who's a researcher, a doctoral student. One of you I know is doing policy. So, policy's on there. A coach, a leader. So we've got quite a rich room here today. So Dr. Tura mentioned about networking, and Dr. Bully, you mentioned about the time to connect. So this is who's in the room today. And so part of us connecting with each other. All right, so let's see what's on the next slide, Okay, so what are the top 3 parts of your identity that impact who you are in your work? Being a parent, being a spouse, being a scientist, being an immigrant, a Korean American, a person with lived expertise, a health professional, an AARP member. That's fantastic. Someone who's biracial, being a health professional. So lots of different aspects of our identity impact the way we show up to work, right? And what feels really salient, but also the things that really motivate us to do this work. So, all right, thank you so much for responding to that Menti. And so I would like to invite you as we go through the day today to really don't shy away from the pieces of you that motivate you to do this work, and engage with the part that's the various parts of you. Okay, so here's what I'm here to talk about, the National Child Traumatic Stress Network's mission and vision, and then I'm also telling you about the network and the ways that the impact of the network, and also the Lotus project specifically, and then also to share a couple of different resources and how you can get involved. So, as we go, all right, so here's the next question for you. I am not a talk at you kind of person, so I like to interact with you. So here's the next question on this slide. When do you think the National Child Traumatic Stress Network was created? It's a wild guess. So, is it a wild guess? Let me make sure. What am I doing in that Menti? It should pop up on your next screen, next QR code on that Menti. A couple of you have responded. Let's see. Actually, let me go back to that slide so you can scan that. Let's see. Let's take a guess. When was the National Child Traumatic Stress Network created? And then while you have that Mentimeter up, there are a few more questions. You can just answer that at your pace. And I'll keep coming back to this. And I'll go right here. Okay, let's see. I have 10 people in the room that have responded. So I'll wait for a couple more responses. So was it created in 1980, 2016? We have a tie. I want to see if we can break that tie. So some of you can respond to that. Okay. 11 responses. Okay. Oh, 2016. Okay, couple more votes. So all of those who voted on 2000, that's correct. The National Child Traumatic Stress Network was created by Congress in 2000 as part of the Children's Health Act, and it was created to raise the standard of care for trauma of children and families that have experienced trauma. And so it is a unique network of professionals from various different aspects of the workforce, from frontline staff to researchers to folks who have lived expertise. They're the ones who make up the network, and this was created for them to be able to bring together a network that really addressed how do we do this work well together, but that's informed by those who have lived expertise. And so this is the National Child Traumatic Stress Network, and so it is administered by SAMHSA, and also it coordinated by the National Center for Child Traumatic Stress, which is at UCLA and Duke, and I'm at Duke. And so that's where we are. That's the NCTSN. And so a couple more things about the mission of the NCTSN. So it really is the NCTSN, the mission is to raise the standard of care and improve access to services for children who've experienced trauma and the communities that have experienced trauma. And thinking about the population here in this room, we represent a diverse communities, right? And yet, like with this, to what Ben de Guzman shared and Dr. Bui shared, the reality that the intergenerational trauma, that really is represented here in this room as well. And so how do we make sure we bring care to the populations that we serve in a way that is evidence-based, evidence-informed, and high-quality services for kids and families? So that's the mission of the NCTSN. And so the ways that we do that, ways that we actually accomplish this mission, is really thinking about how do we raise public awareness of the scope and the impact of child traumatic stress. And so the PHI project does a fantastic job about this with so much of the trainings that's happening, the social media and the virtual ways of getting the information out to the population that's being served. And then there are a range of effective services and interventions. And so the Lotus project, alongside RAMS, they all are thinking about how do we do this work that is actually culturally adaptable, applicable to Asian Americans and Asian immigrants. And so this is an example of that. And then we also work with systems to ensure that they are trauma informed. So is it the juvenile justice system? Is it the child welfare system? Is it the medical care system? How do we make sure that systems are aware of how to care for kids and families that have been impacted by trauma? And then the really beautiful part about the NCTSN, we do that in community. There's no way we can do this alone, and we have to work together to make sure we can bring great quality services to the kids and families that we're serving. And we do that with partnership. We work alongside. So we're never doing something for a community without them. And so PHI really exudes that. We're really thinking about how do we partner with the community and really be able to serve the community in the way that meets their needs. Okay, so we are gonna do, we're gonna watch a brief video. And I think I'm gonna start right here.
Samsu's National Child Traumatic Stress.
Never mind, the sound's not connected. Let me try.
Sure.
Maybe it's not working.
Share with sound.
It's just
Okay. It's called the honest.
okay.
But I might also play from here too.
Okay.
So if you want, I can just take the computer and move away so that we don't hear the.
Oh, I will. Here we go.
Samsu's National Child Traumatic Stress Network and its partners are hard at work. They've become the expert source for information, resources, and treatment. They're fighting the consequences of child trauma every day, helping children and families. Developing new therapies. Moving best practices into real-world use. Counseling more survivors. Providing effective treatment. Letting survivors know they're not alone. Changing the course of children's lives by changing the course of their care. We can't always prevent the trauma itself, but together we can minimize its impact on all of us. Now with your help, even those with the darkest past can enjoy a brighter future.
Computer went away. Thank you very much. Thank you all for your patience with all our tech situation. Where's my slides now? Okay. Okay. All right. Oh, the mic. Okay. So, really, you are all a part of really caring for the kids and families that have experienced trauma, and we're doing this together. And I might sound like a broken record, but really want to emphasize this reality that there's no way we can do this work alone. And so it's really, the NCTSN is built on the foundation that we do this alongside the kids, the families, the trainers, the researchers, the policymakers, clinicians, and program directors. That's who we're working with to be able to do this work. And there's no way to achieve this mission without you. All right, so now I'm gonna go through the next couple of slides really, really fast. So bear with me on that. All right, so I think the first question on the Menti, and let me switch slides again. So it's about how many sites were funded initially. And so actually, I'm going to go here first. So in 2000, when Congress approved the creation of the National Child Traumatic Stress Network, there were very few sites who were funded. So 21 sites were funded. And then as you can see, most of the country doesn't have a lot of dots. The dots represent the different teams that were funded. And then in 2002, there were more sites. And then I'm going to go really fast with all the colors of all the different cohorts that were funded. And currently, this is where we are at as a network. We have a lot of different sites that have been funded to do this work by SAMHSA. And wow, you all are impressive with how many sites have been funded. So this is what you all voted. So 21 teams were initially funded. Currently, we have 50 Category 2 sites, which is, for example, Lotus project is a Category 2 site, which is they develop culturally adapting in models, but also developing treatment interventions for the particular community. So that's a Category 2. A Lotus project is one of them. And then this 157 teams, they are the Category 3s, which are those who are currently doing the work, providing interventions to kids and families that have experienced trauma. So the RAMS team, all of you on the RAMS team, raise your hands. Yeah, so they are the ones from the Lotus Project partners with really delivering this service. So we have 157 teams. But currently, the network, we have 208 teams across the country doing this work at very different levels. And so, and then there's one Category 2, if you do the math, you're like, it's not adding up. But the 208 comes from really having that Category 1 site, which is the one I'm a part of. Okay, so here's our map now. Here is where there are so many people across the country that are doing trauma treatment and trauma that inform how to bring quality services to kids and families that have experienced trauma. And we, in this room, even though we're a small room, we're doing, our reach is very far and wide. And so here's the map of our currently funded as of 2025. This is still outdated as of 2024 December. So it's that's where we are. So this part might feel a little boring of my slide, but I really want to be able to kind of give you the history of the National Child Traumatic Stress Network. So before, similar to a lot of other work that's happening, but before the establishment of the National Child Traumatic Stress Network, child trauma professionals were doing their own thing in different silos, right? And this can feel very real in your communities. You're like, I'm doing this in this little room, or I'm doing this in our research, we're doing it here, but the connection's really far. And this is something we see in medicine, where there's research that's happening. How do we get that to the people doing the work? And how do we do that soon? And so the National Child Traumatic Stress Network is really bridging that gap of bringing the work, the current research, the evidence to the community serving kids and families. And so doing that in a more efficient way, in a way that really meets the needs and the demands. And so really the NCTSN is an integral part. There are so many key components of the work that we do. And so I talked a little bit about this. So the key components are folks that are the coordinating center, those that are doing the research, developing research. So if you have an idea as to I think this part of this intervention doesn't work. So Dr. Toure and his team would be a fantastic starting place as to, can we have a conversation about how to do this better? And they will put their minds together as to how to support that. So that's the Category 2. Category 3 are folks that are doing the work on the ground of delivering the services. One of the things that's really unique about the National Child Traumatic Stress Network, you don't have to be currently funded to do the work. Let's say you were on a team that was previously funded, you can still be a part of it. That's an affiliate part of the program. And then the family and young adult partners, they're the ones really that inform the work they're the lived experts They tell us, like, is this actually working? Because sometimes we create things when we're devoid of the community that we're creating something for, we kind of get misattuned. We miss the mark. And so really, what does it look like to do this alongside kids and families that will tell us, this is great, this sucks, don't do this part. So really thinking about this is really integral to the part of the work that we do. And Samson's the one that funds this work that's happening across the country. And so now I'm going to get to talk about the impact of the work, and which is a fun part for me. I shared this with my mom yesterday, and she was like, the numbers are really boring. But anyway, I'm like, it's kind of important. Like, I have to tell them about it. So I'll see if you'll tell me if I'm making sense. So there are a couple of different layers of impact that's happening. There's a policy level impact, right? Like the policy has to fund the work that we're doing. So there's lots of advocacy that's happening. And Ben, thank you for your work to continue to do this work here in C, but also champion the different efforts. Dr. Bowie, thank you for just even your work, right? As to as an epidemiologist, how do we do this work well? How do we make sure we're addressing the needs of the community? And so many of you are doing this work. And so there's a policy level work. Then there's the reality of how do we make sure our clinicians and our service providers are trained in this work, how to do this work, right? Like there's the reality of like, how do you do this well? And so that's the training that happens of the workforce. And then the reality of the children and families that are receiving the services. And so I get to brag about PHI in a second. Okay, so this one is just 1/4. So 3 months worth of work of the whole National Child Traumatic Stress Network. 90,000 kids got trauma services in 3 months. And that's a low average, by the way. And I just wanted to the reality of sitting with this big picture of what the work that's happening, where there's this many kids that need trauma services. And this is low. We're not reaching every kid that needs trauma services. I don't know, I feel the energy in the room, like, oh, that's a lot of kids that needs trauma services. And currently, with what's happening in our country and in the globe, the need for trauma services is a lot higher. And you are absolutely important to meeting this need, regardless of what role you're playing. And so in 2023, just with the National Child Traumatic Stress Network, so there are only 208 teams across the country, very small amount of teams that are doing this part of this network. And in 2023, about 348,000 kids received services for trauma. And so that's in 1 year, right? And just kind of really thinking about the impact of the work. So the NCTSN is funded here in the US, but also in US territories as well. So in Puerto Rico and in Guam and DC. It gets complicated because I get confused as to like, so what's DC again? But anyway, that's a different story for another day. So that's the work across the country of the kids and families that have received services. This is the work about the training, the workforce. The reality of how do we get this research that's happening, that's current, to the clinicians, to the service providers to do this work. How do we do that? We have to train them. And so the Lotus project has a lot of work around this, but this is nationally the landscape of of the work that has happened and the impact. So in the first quarter in 2023, in 3 months, 61,000 people were trained in how to deliver trauma services. And in 2024, 70,000 people were trained on how to do trauma services. And so in the first quarter of 2024 alone, there were 8,511 hours of training that happened for all child serving systems across the country. And so to put this into perspective, that's about 213 work weeks, and that's 4 years of work in 3 months. That has happened. So this network is some superstars. I feel really humbled to be a part of it. So just really thinking about you are part of this work. Of how do we make sure we do this well? So that's the numbers from a national perspective. I want to focus a little bit with the Lotus project. So the Lotus project, they were first funded in 2016 with the IWAY, which was improving the well-being for Asian youth. And in this project, so their focus is really thinking about how do we culturally adapt and how do we provide culturally appropriate services to the Asian American and Asian immigrant youth. And so they, as a team, have served about 50,000 kids. Isn't that amazing? I mean, I'm just like very happy that you all have done that kind of work. Just to not hurt your ears, just to know that this team, right, like the Lotus project, which has partners like you at RANS, you're doing this work. And so thank you for your hard work that you do every day of showing up and really thinking about the kids and families that need the services. And so this one, it's a busy slide. This is it's a snapshot of some of the work that this team has done. So this team does webinars, does workshops like this across the country. And so they, in which year was this? Let me look at this data. So this team had about 870 people attend their trainings. That's a lot of people for like a team of what, 4 people? 3 people? Not a lot of people, but they've had just in one of the webinars. This is who they reached, and so they're really stellar at doing what they're doing. And so, just also for you to know, I'm gonna come to this slide, but really think of how you, as folks across the country, really use PHI as a resource. We're really thinking about how do we make sure to get trauma, what it means to be trauma informed, to provide trauma services to kids and families. They do webinars and workshops, and if there's something that you are looking for, they most probably have it. So I just thank you to the PHI team. I know it's super early morning for you right now, and you're coming from the West Coast, so I am really glad to be here and just meet you all in person and speak to the work that you all are doing. And they'll be able to kind of, with the data questions, Min somewhere here in the room somewhere. And anyway, the team is able to speak to you about the data. I'm happy to answer some questions with that, but they're much better about that. Oh, what team is this on? Okay. All right. I want to read a quote from someone who actually got a training from the PHIT. And so this person said, I'm not in the field of sociology or psychology. I'm a program coordinator for a cultural center trying to learn from current health content and really appreciated this web series. I love this. I love that this was free, and I took notes as the definitions were in plain language for the audience to understand. I'm getting a better understanding of how to approach distraught students of my community and respond to their needs, and also how to connect them with counselors that will be a good fit. So then that's what, I should do one. Okay. Hopefully it's not too much over there. But that's this team's work. Just really bringing culturally adapted, culturally appropriate trainings, but in a way that really meets the needs of the community, and not like all the jargon. I mean, I know we like jargon, but it's nice to just not have to think so hard, right? And like make it applicable. So this team does that. All right. So here's what I would like you to do. That mentee asked, how do you currently connect with the network? So if you responded to that, how do I make this go away? Okay, so if you can respond to that. While you're responding to that, I'm going to ask you to do something else. I want to tell you about the Learning Center, which is actually free to all of you. It's the National Child Traumatic Stress Network that has created all the different tools, resources that's available to you. So you go to learn.nctsn.org. And I'll say that again, learn.nctsn.org. And this is a learning center. You can have access to lots of different resources. You most probably will get very overwhelmed. It's like a lot of stuff from 25 years of brilliant people doing this work. So I would recommend if you have a question, please reach out to me. If you're looking for something you can find, please reach out to me. I'd be happy to tell you about it. So that's the Learning Center. So it's available to anyone, anywhere. Anyone, anywhere. So you don't have to be a network member. You can have access to this. It's free to you. This is part of my mission also to tell people about it. So if you're ever looking for culturally validated tools in your settings, you don't have to figure that out on your own. People have done that work, most likely. Or if it's missing, you can tell us about it so that you can help create it and we can make sure it gets out there. So, okay. So this is my last slide. I really appreciate all of your attention. These are just ways to connect with us. Invite you to connect with us. Here's the PHI's info. So the webinars and all the different tools are with PHI. So I would recommend that website. I am not great at social media. So here are all the options for all of you who do social media. Okay, I think that's all I have. Thank you so much all for all your work that you're doing and that we get to do this together.